So good afternoon. Today, Lieutenant Governor Polito and I are pleased to be joined by Secretary Sutters, as usual, and Michael Curry, who's the head of the League of Community Health Centers here in the Commonwealth, to talk about an update on the vaccine program here in Massachusetts. But first, I do want to give a quick update on the COVID-19 numbers. Yesterday, the Department of Public Health reported 3,750 new cases of COVID-19. That was on a base of 327 new tests, and over 12.9 million tests in total have been reported so far in Massachusetts. 1,946 individuals are in the hospital being treated for COVID, and 409 are in the ICU. Obviously, this is a continuation of a positive trend we talked about a week ago. The 7-day average of confirmed cases is just below 4,000, which is the lowest value we've seen since December 4th during the post-Thanksgiving surge. The 7-day positive test rate is below 5% at 4.85% for the first time since the end of November. And our hospital census is below 2,000 COVID patients, coming in at 1,946, which is the lowest number we've seen since the 19th of December. Obviously, we still have a lot to do, and we absolutely need to stay vigilant with respect to COVID. But after the surge of the holiday, and thanks to the hard work of everybody here in the Commonwealth, the data seems to be moving in the right direction. Due to that positive momentum, we announced last week that we were lifting some of the restrictions that were associated with the surge in the first place, and we hope to be able to continue that reopening process. But obviously, we need to continue to see positive trends to make that happen. Now, after months of battling this horrific virus, the vaccine, as we all know, is finally here, and with that, a path to return to normal. To prepare for the task of quickly vaccinating at least 85% of our residents, that's 4 million eligible residents, and depending upon which vaccines get approved, we would be double dosing many of those people. We created a vaccine advisory board to guide us on this. It's comprised of medical professionals, community leaders, and other local officials, and came up with a phasing plan. That plan protects the healthcare system, our most vulnerable residents, and addresses equity, particularly for communities of color that have just been disproportionately impacted by COVID-19. And on December 14th, we vaccinated our first resident. Since then, we've made progress, and now everyone in phase 1 is eligible to be vaccinated. That includes all healthcare workers, all first responders, all long-term care residents and staff, and residents and staff of different congregate care facilities, such as those that serve the homeless, people with developmental disabilities, and people with mental health issues. As of this past Saturday, 448,892 doses, that's first and second for some people, of vaccine have been administered for phase 1. Lieutenant Governor Polito will talk more about that in a minute. Today, we're also announcing the next expansion of vaccination sites across every section of the Commonwealth. At the end of this week, there will be 103 publicly available vaccine sites in Massachusetts. Between these sites and other vaccine clinics for places like long-term care facilities, we'll have capacity to administer 242,000 vaccinations per week. And by mid-February, we plan to have 165 publicly available vaccination sites with the capacity to administer 305,000 vaccines per week. Two important things to note here. First, the capacity to vaccinate is not the same as shots administered. Capacity is what we plan to have the sites, staff, and logistics in place to do. And that would represent 242,000 vaccines next week and 305,000 vaccines the week of February 15th. But those results will depend on several variables, including the availability of doses from the federal government. Second, we're setting up the capacity to administer far more doses than we are currently receiving or projecting to receive from the feds. What this means is if we continue to get the same number of doses we're getting now, we may end up with some empty sites and some empty seats and empty appointments at some of our sites. But we think it's better to overplan at this point in the process and hope that the feds can get there than to underprepare and have them be there when we need to be there. Mass.gov/COVID vaccine has details on who's eligible and has a map of all the available sites that are open and sites that will soon come online. The Command Center will keep updating this map on a regular basis. The website's where everybody should go for information on when they can get a vaccine and where they can get it. The map allows those who are eligible to make appointments at a site that's convenient to them. Vaccination sites are established in every region to provide maximum efficiency, geographic spread, and equity for our residents, and our goal is to keep building capacity, but we can only move as fast as the federal government ships vaccines to the Commonwealth. Right now, we plan to set up 7 mass vaccination sites, which we would describe as mega capacity and efficient. In addition to Gillette Stadium in Foxborough and Fenway Park, sites will open in Springfield, Danvers, and Roxbury. The Springfield site is opening on the 29th of January at the Eastfield Mall. The Danvers site is opening on February 3rd at the Doubletree Hilton Hotel. And in collaboration with the City of Boston, the Reggie Lewis Center will open the first week of February. We'll have more details on this and 2 additional mass vaccination sites in the near future. These sites will begin vaccinating around 500 people per day, and some sites will ramp up to as many as 5,000 per day pretty quickly, with a total weekly capacity of 76,000 per week by the middle of February. Eligible residents in Phase 1 will be able to schedule appointments online for the Fenway, Springfield, and Danvers sites beginning on Wednesday, and appointments should be booked online through the map on the website I mentioned earlier. In addition to these large-scale sites, our administration is establishing other public vaccination sites at a variety of different locations in every region of the Commonwealth, and is partnering with many communities that will operate a local clinic to serve their residents. Public vaccination sites listed on the map include places like pharmacies, community clinics, and other providers. These are facilities and organizations that have experience administering vaccines efficiently and safely. Some of these sites are more convenient for harder to reach populations and are located in communities with extremely high rates of transmission. They're marked on the vaccine map as public vaccine sites and restricted vaccine sites. This week alone, we're opening 57 more of these sites. This includes 43 new pharmacy and retail locations like the Big Y, Wegmans, Price Chopper, Hannaford, Stop and Shop, and CVS Health. By the 15th of February, we expect to have 71 retail pharmacy sites open. And as I mentioned, these sites are established to create more equitable access to all communities. Some of the sites are restricted because they're smaller scale operations, operated in many cases by the community and limited to residents from certain communities, cities and towns, or dedicated to certain workers like first responders. They're marked in yellow on the map. If you have questions about when you're eligible to receive vaccine and what sites are available to you, please visit the website and check out the vaccine map for details. Keep in mind that we're going to continue to add to this map as we get more vaccine from the federal government, so everyone should feel free to check back for more sites when they become eligible. Our goal remains the same: to provide our healthcare system with the support that they need to protect our most vulnerable residents and to ensure an equitable distribution of the vaccine to all residents. Today we're announcing updates for the Phase 2 priority groups. Phase 2 vaccines will begin for the first priority group, that's everyone over the age of 75, starting on February 1st. Consistent with CDC guidance, We're also moving residents age 65 and older ahead in the order. This group will start getting vaccines after residents age 75 and older. That's a lot of information, so to recap this a bit, Phase 2 will now go as follows. Adults that are age 75 and older, adults that are age 65 and older, and individuals with 2 or more comorbidities. Early education and K-12 workers, transit utility, food and agriculture, sanitation, public works, and public health workers, and then individuals with 1 comorbidity. Again, beginning on February 1st, adults 75 and over will be eligible to get vaccinated. Residents aged 75 and older will be able to make their appointments online beginning Wednesday through sites on our vaccination map. All this information is available at mass.gov COVID vaccine. To close, I want to run through how residents should approach this process. Visit mass.gov/COVID vaccine and check which group you fall into. If you have a serious medical condition such as asthma or you aren't sure if that changes your eligibility, you should reach out to and contact your doctor. When the state announces that your priority group is eligible, visit mass.gov/COVID vaccine and find an available location near you, and by using that map, click on that vaccine site convenient to you to schedule an appointment online. We're committed to making that process as efficient and as equitable as possible. We all know that COVID-19 has been an incredible burden to every resident over the course of the past 10 months. But the vaccine does offer, finally, a light at the end of the tunnel. These vaccines are safe, have been put through the same rigorous testing as all other vaccines, and millions of doctors, nurses, and medical workers have gotten their shots. So we want to make sure that everyone has access to the information that they need, and we're hopeful that brighter days are ahead for Massachusetts and everybody else across the Commonwealth and around the world. Please continue to do your part in the meantime to stop the spread. I didn't spend a lot of time talking about it today, but as you can tell from all our daily data, because of the hard work of everybody here in the Commonwealth, we are finally seeing some positive trends that have a bit of sustainability with respect to the second surge. That's all thanks to you.